The obesity epidemic is spreading in America, and now it has significant impact on children as well. Taryn Stansberry has the story.
That's right. Researchers have noticed girls going through puberty earlier in the last decade, but now they think the cause is childhood obesity. A new study shows girls who are heavier go through puberty much earlier, some as young as 8 years old.
It's kind of tricky for them because they tend to be in demand, so to speak. So what they have is the attention of adolescent boys or males who are older than them, giving them the attention that at their age they're not necessarily equipped to handle.
Researchers say the increased body weight in younger girls triggers the body to believe it's older and start maturation earlier. This trend spurred marketers into creating child-sized sanitary pads and deodorants for 8 to 10-year-olds. This gives the girls even more they have to adapt to.
It's more of a social-emotional adjustment question that we would have to ask.
But the physical adjustment includes changing children's eating habits.
The best way to really combat childhood obesity and kind of in turn to combat the early onset of puberty is to really just address healthy eating habits earlier on and really helping the child to instill good eating habits at a very early age. And that means following the USDA MyPlate, it means following the dietary guidelines, eating your 5 to 9 servings of fruits and vegetables per day. And that's really the responsibility of nutrition educators, but also it's the responsibility of parents.
Winston says education is key to keep kids from obesity. She suggests parents can get nutrition information from their physicians, registered dietitians, employee wellness programs, or reliable internet sources.
Children are very malleable. They absorb a lot of information. So when you teach them at an early age, that really can have benefits later on in life.
Dr. Winston did say she is optimistic that children can find a healthy weight and keep their childhoods for a little longer. Finding that healthy weight isn't just about eating more fruits and vegetables, though. It's also about cutting the bad fats out of your diet. The Food and Drug Administration took the first steps last week to banning trans fats throughout the country. Here to discuss the proposed ban on trans fats is Devin Ellsworth. Devin is a graduate student of Health Promotion Management at American University. Thanks for being here, Devin.
Yeah, thanks.
So first of all, tell me, what are trans fats and why are they so bad for us?
So when we talk about trans fats, we really have to understand that there are two main sources of trans fats in the diet. They are naturally occurring in certain animal products, meat and dairy products, but then they're also in processed foods as well. And that when we talk about especially this FDA ruling, that's really what we're targeting, is the processed sources of trans fats. And basically a trans fat is created when a liquid fat is made into a solid. So if you think of Crisco or margarine, things like that, and food manufacturers end up using it to create products like cakes and cookies and breads and things like that. And so they cause issues in the diet because studies have shown that not only do they raise your bad cholesterol, but they actually also lower your good cholesterol. So they're particularly problematic.
Now, the FDA says consumption of trans fats has gone down in the U.S. from 4.6 grams per person per day in 2003 to 1 gram per day in 2012. They still say that's too much, though. New York City first banned trans fats in 2007. Is it plausible to ban them throughout the country?
I definitely think it is. There is no health benefit to them, and in fact, the food industry is already working on finding substitutes to replace them. And the results from New York City have been pretty promising, that they have seen some health benefits to the ban. So I really think there's no reason not to go for it.
Well, the U.S. Centers for Disease Control and Prevention say banning trans fats could prevent up to 20,000 heart attacks per year and up to 7,000 deaths from heart disease every year. Even if the ban doesn't pass, how can Americans avoid trans fats? What should they be eating instead?
Well, it's a little bit tricky. So the FDA required that food manufacturers label trans fats on all of their products back in 2006. And that's why we've seen a pretty steady decline in how much we're eating. However, the problem is that you can still have half of a gram per serving and label it as 0. That was part of the ruling. So one of the things that consumers can do is simply look at the food label, at the ingredient list, and if it says partially hydrogenated oils, that's a dead giveaway that there's going to be trans fats in there. Of course, I would advocate for avoiding all processed foods as much as possible, since there's really low nutrient content in them. But in general, just being more conscious of reading the labels and reading the ingredient lists will really help.
So even if there are partially hydrogenated oils in there, it can still say that there are no trans fats even if there is half a gram?
That's exactly right. Yeah, it can still contain 0.5 grams and be labeled as 0. That was part of the ruling. So that's why this ban is really important, I think.
Great. Are there other places where this ban has gone into effect? I know McDonald's has already worked to bring trans fats out of their meals. Will there be a lot of pushback from other corporations?
There has sort of been this movement slowly building with fast food companies. The Center for Science and the Public Interest is located in DC. They're a nonprofit, and they've sued places like KFC, McDonald's, and Burger King to try to get them to remove trans fats. And over time, they slowly do find alternatives. So I think the food industry will follow suit in time.
Great. Well, Devin Ellsworth, thank you so much for being here today.
Thanks.
Thank you for your tips. Now back to the desk.
Thanks, Taryn. Coming up after the break, the Affordable Care Act is still causing problems for Americans trying to get health care. We have an expert in the studio to tell us why. Stay with us.